So our second strategy is the patient's sense of control over a potential threatening environment. When an individual perceives a situation as harmful or threatening over which he or she has little control, fear increases. When individuals believe that there is at least some control over the situation, both fear and then the need to exercise control decrease. Fearful patients have lower pain tolerance. It is important to provide patients with the means of control over the situation in order to decrease fear and increase pain tolerance. There are 4 methods for providing patient with control. There's the informative, cognitive, behavioral, and retrospective. The first one we'll talk about is the informative control, which communicates to the patient what is to be expected or what is to expect. This is where you provide a simple description immediately before the treatment with the emphasis on the sensation that the patient will experience. This helps fearful patients, especially those who have avoided dentistry for a long time, to know what is to be expected or what they will expect. To understand that any sensation they experience is normal, and to avoid being alarmed by them. This is the tell, show, do technique. The cognitive control involves mental method through which the patient can lessen their fear, negative thoughts, and their reaction to these thoughts. If someone refers to, or it is sometimes referred to as the relaxing the mind, and include distraction, guided imagery, focusing attention, and positive coping statements. Distraction strategy include watching TV, listening to music, or the clinician's conversation. The guided imagery provide patient with the active role, replacing negative thoughts with mental image of pleasant scenes or scenery. Focusing attention is the technique used to prevent what are known as anticipating anxiety or thoughts of what might happen during treatment. Clinicians are able to redirect the patient's attention to the experience of the moment by checking in frequently with providing rest breaks. Questions such as, how is it going right now, and is anything hurting you, can be helpful. Positive coping statements are statements or phrases that replace negative thoughts. These phrases do not have to be complex. Some examples are, I can do this isn't so bad, I will make it, or I am a capable person, I can get through this. The behavior control, which is my favorite, allows the patient to take action to lessen, shorten, or terminate stressful situations. One of the most familiar of these is the use of hand signals to stop procedure. Fearful patients should be given permission to discontinue procedure for any reason, including escalating anxiety. Planned rest breaks can also be beneficial for a fearful patient. Even when patients indicate that they would like to push on and get it done, it is important to give breaks in order to allow them to catch their breath before proceeding. The retrospective control is the post-treatment discussion of the appointment experience. Fearful patient may have a difficult time getting through the appointment. This is when you ask for feedback from the patient regarding the aspect of the appointment that was helpful and those that were not. Finally, we'll talk about the patient's ability to cope with stressful situations. This is the relaxation technique, which is the number one way to cope. It is important to emphasize that relaxation is a learned skill and that its effectiveness increased with practice. If the patient has no previous experience with relaxation technique and does not know how to relax, the clinician will need to teach the appropriate skills for the patient to cope with the treatment. Deep breathing is a familiar relaxation technique that can be taught by means of simple demonstration. Patients with anxiety reduce their level of fear and anxiety using this technique. Another technique is the progressive muscle relaxation. The muscle relaxation reduces tension and blocks anxiety. Anyone have any questions? Nope. Stephen, how many minutes are we at?